Hi, I'm Lucia Gambuza with Ophthalmology Times Europe. Today we will be covering the European Dry Eye Society Congress held on June 18th through 20th in Milan, Italy. Joining me is Dr. Piotr Woźniak, a refractive surgeon and dry eye specialist at Optegra Eye Healthcare Clinic in Warsaw, who presented a retrospective real-world evidence study on clinical outcomes, utilization patterns, and practitioner satisfaction with Artelac Complete dry eye lubricating drops. Dr. Woźniak, thank you so much for joining me today.
Thank you for having me here. It's a pleasure to discuss the work, and I'm really happy that ophthalmology in Europe will have a chance to see our work.
Of course. Can you start by walking us through your study that you presented? What did you set out to look at with Artelac Complete, and what did you find?
So the core focus of our presentation at the Congress was to evaluate the clinical performance of Artelac Complete and Artelac Ultra 4S through the lens of the patients. So in today's practice, in today's ophthalmology practice, bridging the gap between controlled clinical trials and actual day-to-day patient outcomes is absolutely critical. So we wanted to look closely about the unmet needs in dry eye, and especially how we can better manage symptom severity and in the drivers of patient populations outside the strictly controlled trials environment.
So, six eye care practitioners across several countries also completed a satisfaction survey as part of this study. What did that side of the data tell you?
So what we are looking still for more. So this is just the beginning of our journey with this study, and we are looking for more practitioners to join our study. As far as I know, now we have more than 50 cases all around. So we all know that dry eye is complex, multifactorial conditions, and it's very often with a significant evaporative component. And Artelac Complete is formulated with multiple components. So it also includes the hyaluronic acids, but also lipids. And our real-world evidence demonstrates that this comprehensive mechanism doesn't just briefly mark the systems, but it's actually stabilized the tear film, and it provided the sustained relief that patterns we are looking for.
Your server data also looked at how practitioners are actually using lubricating drops with their dry eye patients, for example, around cataract or refractive surgery or in contact lens wearers. What did
Mhm.
you learn about how these drops are being used in practice that might have surprised you or that you think other clinicians should know?
So the findings are highly accountable for any modern ophthalmological practice. And in our premium settings, premium clinical settings, when we especially seeing the patients undergoing refractive surgery, this integrity of the ocular surface dictates the final visual outcomes. And for me, the most important thing that we found out was that we can stabilize the ocular surface very fast. So the effective of the treatment was very fast, and that's what we see in the results. As I told you, these results are very preliminary, and we are looking for more results. However, as far as we can see, we almost doubled the tear breakup time and almost doubled the Schirmer results, which is fantastic the achievement.
Stepping back from your own presentation, was there a talk or piece of research from this year's Dry Eye Society Congress that might have stood out to you or that's changed how you're thinking about your own practice?
Oh, that's a very tough question. It was a very good meeting if it comes to EuDEC. It For me, it's always getting new knowledge. We learned a lot about the neuropathic pain and new treatments. These are maybe not our most common patients in our clinics. However, these are the patients that really suffers. And to be honest, we don't have only one good way of treatment, and there is not one not single answer to their needs. So yeah, EuDEC was great. There were lots of high quality presentations, lots of new science. As far as I know, more than 700 people attended the EuDEC, and it's always nice to mingle with other specialists to discuss the ocular surface problems, because we are now in front of computer, and digital screens are one of the most common of our problems.
Dr. Wozniak, thank you so much for taking the time to speak with us today. For more coverage from European Dry Eye Society Congress 2026, visit europe.ophthalmologytimes.com.